All right, hey guys. So here we have Evan again. Evan has lots of nerve issues. So we've talked about Evan's sciatic peroneal nerve issues, and we've talked a little bit about his ulnar nerve problems. He's also having some kind of posterior shoulder issues. And Evan told me recently that he did have a AC joint separation in the past. So one thing, he basically had a long chronic history of shoulder issues, and it typically hurts him when he does incline bench press. And so he's kind of describing the symptoms to me, and thinking that it was most likely a shoulder problem. And as we got to talking about it, it sounded more like possibly another nerve problem. So once you have multiple nerve issues in upper and lower quadrants, you have the tendency to be a little more nervy. So Evan, go ahead and straighten your legs, and we'll demonstrate just real quick the axillary nerve test, because that's kind of what it sounded like. Go ahead and scoot your shoulder towards me a little bit, like scoot your trunk this way, and then good, there you go. So axillary nerve test is going to be shoulder internal rotation, scapular depression, cervical side bending. So we'll start off there. We're going to depress the shoulder, internally rotate the shoulder. Tell me when you feel it.
There.
Okay? Now, bring your ear back towards my hand. Does that relieve the symptom?
Yes.
Okay. So, and the symptom was in the back of your shoulder, correct?
Yes.
Okay, so if he moves his head and it changes the symptom in the back of his shoulder, we know we're dealing most likely with a nerve problem. So, axillary nerve is kind of a funny nerve. You tend to see it, I think it goes missed quite a bit, especially in post-surgical cases, but also, when you have a chronic shoulder condition, kind of like Evan has, and when you know that he's prone to other nerve injuries or nerve issues, be on the lookout for a nerve problem. So axillary nerve specifically, there's a few cases when it tends to pop up. One would be shoulder dislocations. Two would be shoulder surgeries. Three, you will see it just with rotator cuff atrophy, and I did some testing on Evan earlier, and he does have some posterior cuff atrophy, and so where the axillary nerve comes out of is the quadrangular space. You can tend to get some impingement in there if the mechanics of the shoulder are a little funny, which they are when he does that incline bench press movement. So Evan, because of the mechanics of his shoulder, he does kind of fit that profile, having some rotator cuff issues and some rotator cuff deficits more on his right side. He had a positive infraspinatus test, and he has pain. The pain reproduction of his axillary nerve happens with, so we'll demonstrate here. So Evan, go ahead and resist external rotations. Right there, and you feel that there.
Yeah.
Right? Yeah. So that reproduces a symptom. If we were to resist internal rotation, go ahead and resist there. Anything?
No.
Okay, good. Come back here. We'll resist this motion. Relax, relax. Hold there, don't let me push.
Yeah.
Yeah, so he's feeling it at the maximum end ranges for both internal and external rotation. So putting his teres major, max stretch resistant, he's feeling it. Teres major is a border of the axillary nerve. Putting the posterior cuff at the end range and resisting it also borders the posterior, or teres minor anyway, also borders the axillary nerve. So putting either one at its end range and then contracting different muscles reproduces the nerve pain. So we've kind of isolated down that he has a quadrangular space problem. So just something to be thinking about in the future when teasing out possible conditions. If someone's complaining of like that rear delt pain that you'll see people have, especially after a surgery. Oh, another one, frozen shoulders. You'll see that pop up with frozen shoulders as well. So it's not always a muscular problem, and axillary nerve doesn't radiate very far. It's pretty isolated to the rear delt region. So just something to think about to add to your evaluation process.